Thank you all so much for joining us. My name is Jess Taylor. I am the CEO of QENDO, and we are delighted to welcome you here to another event with an hour with QENDO. We have been running these for quite some time, and the idea of these events is to open up and expand your toolbox of understanding, of knowing, of learning about how to manage endo, pelvic pain, adenomyosis, all of the things that we are living with. And today we are joined by Professor Suzanne Nielsen, who is a registered pharmacist in NHMRC, which is the National Health Medical Research Council. So they're those big federal funders that fund big amounts of bodies of work and research. Susie is a leadership fellow with them and has a strong focus on improving the safe and effective use of medicines, including opioids, for people living with chronic pain. Susie, your research explores how to optimize pain management whilst minimizing risks associated with prescriptions, over-the-counter medications, and emerging medications. Susie works closely with health professionals and policymakers to support evidence-based approaches to pelvic pain care and medication safety. Thank you for joining us, Susie. This is such an important topic that we've needing to delve into, particularly around the use of opioids as a tool. That's what it is. It's another tool for people with endo, pelvic pain, and chronic conditions. So thanks for being here.
Great, thank you so much for having me. So today I'm going to talk a little bit about the Opioid Safety Toolkit. I've got a little bit of information prepared to share with you, but I think we'll also have plenty of time for discussion and questions. And hopefully, if you do have any questions either about the toolkit or about opioid safety more broadly, we will have time to cover those. There is a disclaimer slide just to acknowledge that this presentation does not replace treatment provided by medical professionals and allied health professionals. And obviously the treatment of endometriosis responds best to evidence-based multidisciplinary care, which I'm not providing as part of this webinar and which you should access elsewhere. But hopefully this information can be part of empowering you in that way. So I'm going to talk a little about the Opioid Safety Toolkit, including where to access the toolkit, and I'll give you some links so you can have a look at it yourself. I will cover some of the things that the toolkit contains briefly, but you'll be able to go back and access any part of the toolkit that's available free online. And I'll also provide you a little bit of information about opioid safety and naloxone. And we can have in questions, I guess, anything that broadly relates to those topics as well. Before I get started, about the toolkit itself, I really wanted to talk about why we decided to develop an opioid safety toolkit. We know that opioids can be a really important tool for pain management as part of a multidisciplinary sort of pain management approach, but we also know that we do see harms in our community with opioids, and we still see, for the last decade or so, more than 1,000 lives lost every year from opioid-related deaths, and around 2/3 of those involve prescription opioids. So the toolkit is really aiming to get that balance of these really important medications that can help people manage pain, but also having that safety around them to try and minimize the harms. What we discovered from a lot of our earlier research is not everybody who's prescribed opioids is aware of the risks and how they can reduce their own risks with opioids. And in fact, some people weren't even aware that they are, in fact, prescribed an opioid. That's probably changed a lot in the last 5 to 10 years because we have had a lot of focus on opioids, a lot of discussion around opioids in the community. And in fact, maybe it's gone the other way where people are acutely aware that they're on opioids and they're worried about what's going to happen to their opioids because we have had so much focus on kind of opioid prescribing. And we do hear often that some people are having difficulty accessing opioids. Because of that, we've often found that sometimes those great conversations between healthcare providers and people who are taking opioids are not happening because there's a fear of, perhaps raising concerns that you might have and wondering whether or not that might affect your access to opioids for pain. And so what we really wanted to try and do is develop a toolkit that was able to provide people kind of evidence-based information so that they were empowered around safe opioid use, and try and get around some of that fear and some of that stigma that we know exists with with opioids and opioid use that can be a barrier to kind of getting that good information and having those great conversations. We think it's really important that when opioids are used, they're used well and they're used in ways that any risks are minimised. And we also know it's really important the way in which we communicate information around opioids, because there has been so much stigma, so much fear, and often that means that people are scared to speak up. We also had, before we developed this toolkit, a whole bunch of tools that were developed to help people monitor their opioid outcomes, to help people be safe in terms of having naloxone. And some of the research that we had around how commonly those tools were being used suggests that there was a lot of potential to kind of really increase how much those have been implemented. So we knew that, for example, naloxone, while it's available for free in pharmacies, it was estimated that only around 2% of the people who are prescribed opioids and could benefit from having naloxone in the home had received it. And we really wanted to close that gap. So to start with, I'm going to provide you a QR code and some information about how to access the Opioid Safety Toolkit. You can just type it into your browser, so saferopioiduse.com.au, or if you've got your phone handy, you can screen that QR code. And if you're, depending on whether or not you're accessing it on a mobile phone or on a desktop, it might look slightly different. So you can see on the left side of the screen, I've got what it would look like if you're looking on your phone. There are a couple of things that I'll cover, which is all covered in the menu bar, which is kind of in these little top 3 hamburger dots up the top. If you're accessing the toolkit on a desktop, it'll look like this, and you can see there's a menu bar along the top of that where you can access the different parts of the Opioid Safety Toolkit. If you want to, you can kind of follow along at home and access the various parts of the toolkit, but if not, that's something that you can do in your own time as well. There's a couple of really key things that we hope people are able to get out of the accessing the toolkit, which includes developing a personalised opioid safety plan, which includes understanding your own risks and also sharing information with maybe friends or family that might need to know about opioid safety. And then the other thing is being able to use the Room tool, which is a tool that can help you monitor your own outcomes with opioids and can help kind of prompt good conversations with healthcare providers, be it your prescriber, a pain specialist, a pharmacist, etc. So I'm just going to go through a few different parts of the toolkit so you've got an idea of what's there. Sorry, I've just covered this. So as mentioned, we really hope that people are able to develop an opioid safety plan, and that would include accessing naloxone, to be able to access the Room tool, the routine opioid outcome monitoring tool, and also access other information and resources. And we actually have on our information and resources page now a link to the QENDO information as well. So hopefully that information can go both ways. People will be able to get information about their pain management, particularly from there as well. So I won't go through everything in terms of developing an opioid safety plan, but you can see a screenshot of what the opioid safety plan looks like in the toolkit. If you access the opioid safety plan, you can actually complete this information yourself and be able to, I guess, cover off some of those factors around reducing your risk, around safe opioid storage, and also getting naloxone. With naloxone, and I don't know how familiar people are with naloxone, but it's an opioid antagonist medication. It's a medication that can reverse the effects of opioids if somebody is having a severe reaction to opioids, which is sometimes called an overdose, but we often don't like to use that language because I think sometimes that language is assumed to mean that people have intentionally taken more of their opioids than are prescribed, or maybe using their opioids in a way that they shouldn't. And actually what we're meaning when we say an overdose is really just that the opioids are having a more severe effect and people are experiencing side effects that needs a kind of a medical response. So all of this is explained both in the opioid safety plan, but also there's a short video that's on the website that explains why we want people to know about naloxone, how to access naloxone, what the signs and symptoms might be of a severe opioid reaction. So things like having depressed breathing and sedation. All of that is covered in this video, and it's also very helpful, I think, if you're on taking opioids and you'd like somebody else in your family to be able to understand what they might want to look out for and understand about opioids and opioid safety, that you could get them to watch the video as well. It's just a 3-minute video and it really covers all of those key points. If you fill in the opioid safety plan in the opioid safety toolkit, you can download a PDF version, you could print it, you can also email it to yourself. So if you wanted to be able to keep a copy of it, you can do that as well. The next bit of the opioid safety toolkit is a routine opioid outcome monitoring tool. This tool is a tool that we developed really with extensive research with people who are prescribed opioids in Australia to really help people be able to monitor both their pain outcomes, side effects, and other key things for your health when you're taking opioids. So when you complete the routine opioid outcome monitoring tool in the toolkit, it will actually provide you feedback around your responses in terms of scoring some of the measures that are in there. It will also provide you again with a summary of your responses that you can email to yourself, you can download it, you can print it, and then you can take that in to your next doctor's appointment or discuss those with your pharmacist if you do want to learn a little bit more about what some of those responses mean. This tool is developed around what's called a 5A's framework, and it kind of covers off the key domains of what experts have identified are the key things to monitor when you're on opioids. And importantly, things like side effects, like your mood, and things that can really help you have conversations around how you're going with your opioids, but also around your safety and kind of getting the best outcome with opioids. So again, this is a screenshot in the Opioid Safety Toolkit. If you want to fill this in yourself, again, go to saferopioiduse.com.au and you're able to, just by going to the Use Room tool button, you're able to complete that and save those scores for yourself. We also have within the toolkit some really great resources around pain management. There's links to different consumer organisations. There's videos around kind of pain science, and I think sometimes understanding pain and how pain kind of, affects the brain, and how chronic pain in particular can have these long-term effects can be really useful. Not everybody finds the same resources helpful, but hopefully for some people there are some things in here that can provide maybe a different way of thinking about the pain that they're experiencing. And as I mentioned, we do have a link to QENDO, so perhaps some people who've maybe aren't familiar with this organisation but discover the toolkit will be able to get additional resources around their pain management for endometriosis or pelvic pain, etc. So that's what's in the toolkit, but I thought it might be really important to understand how this toolkit came about and how it was developed, because a lot of how it's developed, I think, really reflects what's important and what we really understood consumers told us was important around opioids and information around opioids and pain management. So to start with, this toolkit was co-designed with consumers and healthcare professionals through a really detailed co-design process that went over around 6 months. So we had a series of iterative workshops where we brought together we brought together consumers and we brought together health professionals to really understand what were the challenges around opioid safety, what were some of the experiences of people, and we did hear really clearly in this co-design phase that a lot of people are worried about their access to opioids, that maybe had negative experiences, that maybe have got the message that, perhaps their prescriber is worried about prescribing them opioids, but at the same time, they really rely on those opioids as a tool for pain management, and we're, struggling to have those good conversations with prescribers, and maybe struggling to kind of have it appreciated that opioids are an important part of pain management, not for everybody, but for some people, and, really having that validated. We also had health professionals, we had pharmacists, we had GPs, we had pain specialists, making sure that all of the information, the way it was presented, is really evidence-based. But really what you would see if you look through the toolkit is that the language has been really carefully crafted with solid input from consumers at every stage to make sure that it's both clear, it's understandable, and it doesn't perpetuate some of the stigma that people have already kind of experienced around their opioid use, but does effectively increase health literacy around opioids, which is our goal. This toolkit was funded by the Commonwealth Government through a very specific scheme that is around increasing health literacy. So we were really lucky to be able to have this opportunity to work with consumers and health professionals to develop this kind of resource. The other thing that I really want you to know about the toolkit is that after we developed it, after we went through this really extensive 6-month co-design phase to develop the toolkit, not only to develop the content, but also all of the images, the language, the look and feel, to make sure that everything that was in there was what consumers told us was going to be most effective for communicating this really important information. We then did what's called a randomized controlled trial. So we compared this toolkit by having people who are prescribed opioids for pain in Australia either receive the toolkit or another really rigorous resource, which is the NPS Medicine Wise page on opioids. And what we did was test whether or not the toolkit was able to more effectively increase people's knowledge around opioid safety, have people be encouraged and motivated to go and get naloxone and actually go and get naloxone. And also that the toolkit was acceptable. So we had a series of questions there to really understand how people perceive the toolkit. And what we found from that study was that the toolkit did perform much better than existing opioid information for patients. It did really increase people's knowledge around opioid safety, and it made it much, much more likely that people would go and get naloxone from a pharmacy and understand why they would go and get naloxone. So those were really the key goals, and we were really happy to see that the toolkit was able to achieve those goals. And I think the only reason that we were able to do that is that we had such fantastic consumers involved from the very start of this work that were able to tell us what was important to them, and we were able to really build that into every element. Every page that you see in the design of it in the toolkit was driven by information from consumers. I think that was really what I wanted to share with you to get started about opioid safety. I didn't want to spend the entire hour talking in a kind of didactic way, but I'd really like to have this kind of be an open conversation where we maybe can have some questions around the toolkit or questions about opioid safety or naloxone more broadly. So I might hand over to our hosts or anyone in the audience. I'm not actually sure how questions happen, so I'll let somebody open up the questions.
Awesome. Thanks so much, Susie. We've got a couple of questions coming through social media. And for those that are in the room here, if you would like to pop them in the Q&A, down the bottom, there'll be a box that says Q&A, and you can pop them in there and we'll answer them live, or we can take them off. So a couple of questions around the toolbox. So you mentioned health literacy was a goal of the project. What change did you see in people's understanding of opioid safety after using the toolkit?
Yeah, so after using the toolkit, we had a validated scale that essentially measured a whole range of elements of opioid safety, understanding signs and symptoms of what opioid toxicity might look like, how to respond, understanding what naloxone is. And so we saw those scores of people really understanding all of those domains really go up in the toolkit much more so than we saw with the other kind of opioid safety resource. And it was a kind of an active control. So we didn't give people no information. We gave people an alternative resource, and we found that having this kind of really interactive and personalized website was more effective in people being able to get the information they needed about opioid safety.
Following on from that, someone has asked, were there any particular tools or visuals that most helped in shifting the knowledge and the confidence?
That's a really good question. We didn't. We asked people when they were given the toolkit to kind of work their way through the toolkit. The toolkit's actually designed to, I mean, you aren't bound to go through it in a particular order, but it does try and walk you through it in a particular order so people do develop their own opioid safety plan, and then they do use the room tool and they're able to access the resources. And so in general, most people will access all of those things. We did find from the feedback that we got from the trial that a lot of people were saying they found, the information was really accessible, that they were able to download the plan. They found that really useful, that their resources in there were able to kind of prompt conversations. So we designed it quite intentionally, and so it did seem like people followed the flow and worked through that information. The other thing, though, that we found is a lot of people said that they would go back to the resource, and we've seen that. We've had a look at how people use the resource in kind of the web statistics, and a lot of people do visit the toolkit more than once. So it's not like you might just see this, you'll learn the information, and then you'll never go back. People do tend to kind of return to the toolkit to kind of get information at later stages. So yeah, it's not like you have to sit down and kind of study it all in one go. It is something that people can come back to.
And I'm sure it would depend on where someone's at and where someone's at in terms of their openness to take those next steps, as well as their understanding of even the process and even our health system. Would you agree?
Yeah, absolutely. And I think that's part of, for example, with the room tool, that provides people information about their pain, other parts of their health. Um, that's an ongoing process when you're using opioids to manage pain in terms of, are opioids still the best thing for me? Am I still getting kind of good pain relief from them? Are maybe the side effects becoming more problematic? So it's not a kind of a one-off thing. It is really an ongoing, assessment. And, people's health changes over time. And at times opioids might be really important, and then there might be times when maybe they aren't so helpful. Maybe the side effects are becoming really problematic, and that might prompt a conversation around, is there something alternative that I might want to try at that point?
Mm. A question that's come through the Q&A, which is one that we've been asked a number of times. So they've asked if you could share some more information about how naloxone works. They had wrongly assumed it was only for people who had taken very high doses of opioids consistently. Could you break that down a little bit for us?
Yeah, absolutely. So naloxone, it's a really amazing medication in some ways, actually. It's quite short acting, and the only thing that naloxone does is reverse the effects of opioids in a short term. So if somebody is having severe side effects from opioids, and that's the only time that we use naloxone. If someone's having these very severe side effects of opioids, where they've got sort of respiratory depression, severe drowsiness, which are the kind of the symptoms that often precede someone actually stopping breathing altogether or losing consciousness. So if we can intervene before that happens, or if someone is found in the home after that happens, administering naloxone as soon as possible. What it does is it binds to what's called an opioid receptor, which is the part in the body where opioids are having their effect. And it basically knocks the opioid that's currently on the opioid receptor off the opioid receptor. So it stops doing its opioid thing. And within really a couple of minutes, what we see is people's respiration will return to normal. They'll be able to breathe. And that really means that they, protecting their bodily function, their brain, etc., which having an extended period without oxygen is obviously quite dangerous. The way that naloxone is intended to be used is really just as an interim kind of first aid measure while you're waiting for an ambulance. So we often say, we hope the naloxone is like that fire extinguisher or that fire blanket you might have in your kitchen. We hope you never need it, but it's really important to have it there. And in that emergency, it's given either sort of one spray in the nostril, can be repeated after 3 minutes, just enough to be able to get someone breathing again while you're waiting for that ambulance. But it isn't a substitute for medical care. It's really just that interim first aid while we're waiting for an ambulance. But every minute that somebody's not breathing, we know is damaging for them. So the sooner that we can administer naloxone, if someone is having that sort of severe opioid emergency, the better. The other thing that's really great about naloxone is if we have naloxone in the home and we're having these conversations around opioid safety, what we know really tragically from sort of coroner's reports and things is sometimes we've seen, particularly with prescription opioids, that there was somebody in the home that was aware when someone was having the severe opioid symptoms, but they hadn't recognised those symptoms. And because they weren't aware of what those symptoms were, they didn't do anything about it. They thought the person was just snoring loudly, where actually what they had was respiratory distress. And so if they had a little bit more information, maybe if they had have had a conversation around opioid safety, were aware of naloxone, they might have picked up that that was happening and they might have intervened. They might have called an ambulance. They might have given naloxone. So part of having naloxone and how it's so powerful is it can prompt those conversations with family members. So maybe that one time when those symptoms were visible, maybe somebody would have intervened because they would have had that information and they would have been empowered. So even if for many people there's an opioid safety plan in the home that's never needed, it might be that one time where somebody was able to recognize those symptoms and call an ambulance rather than having that person kind of be found the next morning. And those are the kinds of cases that we really hope that, they're very severe cases, but we really hope that we could prevent those.
So, what are the symptoms that we need to watch out for then if someone in our home is taking opioids and we just need to be aware? Or even as people with endo, communicate if we're taking opioids, communicate with our partners or parents.
Yeah, absolutely. So the key things in terms of looking for severe opioid symptoms is someone who's not breathing or they're breathing very slowly. So it can just be like 1 or 2 breaths a minute. You'll notice a very slow rate. If someone's not breathing, what you'll tend to see is that they'll no longer have, if you're like me, no longer have like a pink color in their face. They'll start to look very ashen or grey. If somebody has dark skin, again, it's a very sort of kind of ashen color. There's not that kind of, vibrant look. Often as well, if you see people's fingertips, for example, they might be blue. Often the lips are blue. That's because they're not breathing, and that lack of oxygen is causing that very pale, kind of clammy skin. Those are the symptoms you're looking for. The other thing that's really specific to opioids is very pinpoint pupils. So if you see someone's pupils are really small, that can also give you a clue. You'll also see that someone will be quite sedated. So if somebody is having this kind of severe respiratory depression, it will always be accompanied by someone being very drowsy. So that might be the first thing that you see, is that maybe someone looks very drowsy. They might be sitting on the couch and sort of nodding off, not able to stay awake. Now, these signs and symptoms generally would happen if you took a very large dose of opioids, a larger dose than you're used to, but they can also happen for a range of other reasons. And this is some of the information that we're trying to convey through the toolkit as well. So, for example, if you're taking opioids and maybe you have other medications that are prescribed that are interacting with that, sometimes with what would otherwise be a safe dose of opioids, you can get these symptoms come on. Also, if you've got a change in your health status, so maybe your kidneys or your liver are kind of not functioning as they should be. It could be for a range of reasons. You're not kind of clearing those opioids out of your body at the same rate you normally do. They can accumulate. These are the kinds of scenarios where you might be taking your normal prescribed dose, but you are actually getting those kind of overdose sort of type symptoms. And those are the kinds of things that there is information in the toolkit to educate people to be aware of that, because I think often it's assumed that you're not going to have an overdose unless you've taken a really large dose or you intentionally have done something. And that's actually not the case. Most of the time with these very sad cases where people have passed away, it's been because there were multiple factors that have contributed. It's nobody's fault, but if we're aware of them, we have the power to do something.
So going back to the naloxone question, so if someone does have some of those reactions, could that be a use case for that medication? Or are we only keeping that fire extinguisher at the point where they're not breathing or we're seeing visible signs of they're not breathing? Where could we kind of bring that in without providing medical advice, just to give
Yeah.
some parameters around when is the best place to use it? Can we do that early on?
Yeah, so what we normally recommend is if you think that somebody is in an opioid overdose state, the first thing to do is go and try and wake them up. And if you can wake somebody up by sort of, shaking them, like gently shaking their shoulders, often doing a sternum rub, talking to them. If they are able to be roused, and you can actually often just tell someone to breathe, and that will stimulate them to take a few deep breaths. You'll see that they'll get pink again. This is still, if they're that sedated from their opioids, it's still a medical emergency. I would still be calling an ambulance. But if someone's able to breathe on their own, they don't necessarily need naloxone. But if they're breathing on their own because you're reminding them to breathe, and if you stop reminding them, they get drowsy again, that's still a medical emergency. We still want to call that ambulance. You might still even administer the naloxone because it's difficult to keep them awake. But if someone's just drowsy and then you wake them up and they're kind of, they were maybe they were just tired. We know opioids do make you a little bit sleepy, but then once they're awake, they're fine. Keep an eye on that person, but you probably don't need to give them naloxone if they're able to stay awake and breathe on their own without any kind of prompting. But that's, I think, where the line would be is if you're struggling to keep someone awake, if they can't stay awake themselves, and it might not be an opioid overdose. There can be a range of reasons why people get really sedated. But if someone is losing consciousness, we'd be getting medical help. But if it's because of the opioids, we're able to administer the naloxone and make sure that they're not, they're not going without oxygen for an extended period of time.
So it sounds like it's a really great, tool for when we're waiting, especially for that ambulance, because I'm sure
Yeah.
there's been many examples or situations where people have really gone downhill, particularly with our health system at the moment. It's really tricky. So having a tool in the house, I love the term, the fire extinguisher. That's a really great idea. We do have another question from socials. Switching gears a little bit here. So they've asked, what advice would you have for someone who is afraid to bring up medication concerns with their doctor or health professional out of fear of being judged or not believed?
Yeah, I think that's a really valid concern, and it's very hard to give advice around that without knowing what kind of reaction you're going to get. And I really can empathise with people and being sort of concerned about this. I mean, that was really part of the reason that we developed the toolkit is that we heard from people that, they're really worried about raising questions and maybe aren't asking questions and aren't having those great conversations because of this fear. So that's why we really wanted to get all of this information to be really accessible through the toolkit. Um, I mean, hopefully that people will have a prescriber where if you're able to kind of go in there with some of the information from the toolkit and just demonstrate that you really do understand the risks and you really want to use opioid safety. Hopefully the fact that that you've got this access to information and that you've showing the healthcare provider that you are aware of the risks and you're prioritizing opioid safety as well, and that you can have a really good conversation about that. Hopefully that will make the conversation easier. Um, Obviously, we can have bad experiences with healthcare professionals, and I guess, you know, maybe if there's one healthcare provider that doesn't believe you or that isn't giving you the information that you need, hopefully you can find one that will be able to work with you with opioid safety and pain. But we know that some prescribers are really worried about prescribing opioids and they're being a lot more cautious. I think if they understand that you understand the risks and you're storing the medication safely, that you really are, understanding that this is just part of a pain management program and it's not the only part of your pain management, but it's a tool. I think that would help have those conversations in a way where those prescribers will feel like you really do understand how important it is to understand opioid safety.
We talk a lot about the toolbox and that when we're working with health professionals, we're going into it as a partnership, aren't we? Because we
Mm.
both have an agenda often, we both have expectations, and creating education in patients, consumers can really help also shift the conversation from the health professional's perspective. I feel as though you can have a really different conversation when you have a consumer or a patient that has some level of health literacy. If someone is just completely starting out in this, where would you encourage them to go as, I guess, a takeaway from tonight?
Look, I would just start from the start in the toolkit. The way that the toolkit is designed, and I don't know if you've been to have a look at the website, but the first thing if you go to develop an opioid safety plan is it will ask you questions about yourself. Are you the person taking opioids? Are you caring for someone taking opioids? Are you taking opioids for cancer pain? So that the way that you'll be directed, you'll get information that's relevant to your situation. It will also ask how long you've been taking opioids, because what's relevant for somebody who's only been taking opioids for 2 weeks is quite different to someone who's been taking opioids for many months or years. So I think just kind of being guided through that, so you're getting information that's relevant to you, will be a really good start. we really hope that people come out of the toolkit with kind of two key things: having an opioid safety plan for themselves. That means that they can have those conversations around safety in the home, and then having the room tool so that they're able to, I guess, be more empowered to kind of understand their outcomes with opioids over time. So those would be the places that I would start. But I also think if you feel like that you'd like to learn about a lot about opioids in general, there is an information page on opioids, there's an information page on naloxone, and there's an information page on pain management. So there's a lot of resources in there as well.
I would imagine taking that to emergency or to any health appointment, that plan would be really useful. Do people need to have it signed off by, for those that haven't gone to the website, haven't looked at it, do you need to have it signed off by a health professional, or is it very much a you individual driven activity?
Yeah, it's absolutely consumer-led, developing that opioid safety plan. The opioid safety plan itself will help. It has kind of reminders around some of those risk factors, and it also has reminders around those signs and symptoms of opioid toxicity we discussed before. So you don't have to remember all of that. If you've got an opioid safety plan, the symptoms that you need to look out for are documented on that plan, and you can keep that somewhere that's accessible. In terms of the room tool and monitoring your ongoing outcomes, again, if you complete that tool, it'll ask you just 12 questions about your pain, your symptoms, other things that are going on for you. The toolkit will actually score that tool for you, and it'll provide you information about what those scores mean. So you'll be able to read through that by yourself. There are links. So, for example, if you're currently experiencing a low mood, the toolkit would provide a score that identified that. It will give you some suggestions of consumer resources that you can access, but it would also suggest that this would be a really good thing to talk to with your GP or with your healthcare professionals. And so, again, you don't need to understand what the scores mean. It all is provided in the information that you download. And you can also take that in with you to the healthcare provider appointment. So, for example, you can, rather than having to remember all of that information, you can sit down with your GP and say, look, I did this thing, this is what the scores mean. And it actually means the GP as well can really understand what you're experiencing based on that.
Yeah, people can also upload it to their QENDO app too, where they have all of their other information. They can pop
Oh,
it,
perfect.
take it along with them because we lose
Yeah.
paper, don't we? It's often huge wads of paper that we have. Susie, I'm keen to know your story. Why did you get involved in this? What led you into this work? I know you have a background in pharmacy, but what interested you into this space specifically?
Yeah, so I started off as a pharmacist. I actually worked for a while as a community and hospital pharmacist. And I actually started a lot of my clinical work was working in the area of methadone and buprenorphine treatment. But as I started to do that, we actually started to see a lot more people who were coming into treatment who had been using prescription opioids. And so, as a pharmacist, seeing people ending up sort of needing treatment and developing challenges with the opioids that they were prescribed for their pain, I think really kind of brought home that we need to do more around this medication safety so that people are able to not only use their opioid safety, but also if they do develop opioid dependence, that we've got good treatments for that as well. And we do have really good treatments for that. And I think there's incredible stigma around people who are having challenges in managing their opioids. Um, so I spent a good kind of decade of my career really trying to understand how we can best treat prescription opioid problems, how we can best prevent prescription opioid problems. And from that, we started to develop the tools that you'll see in the toolkit. So the room tool really came out of how can we be able to monitor outcomes with opioids and see when maybe side effects are starting to become problematic so that we can prevent some of that harm. And at the same time, again, seeing the mortality statistics in Australia, we saw that there were just too many people who were prescribed opioids whose lives are being cut short. So again, that all motivated increasing knowledge about naloxone, wanting to have conversations with naloxone. We know that naloxone has actually been promoted a lot for people who are using illicit opioids like heroin, but there wasn't any information that made sense for someone who's prescribed opioids around why they would have naloxone in the home. And you can imagine if you're given a leaflet about naloxone and it talks about heroin use, that's not something you want to take home and share with your family. It's not something that's going to make people feel kind of safe to have those conversations. So we really wanted to have resources that made sense for people who have pain, chronic pain, to be able to talk about opioid safety, that really had the right language and information that was relevant for them. So I guess that's kind of the
Mm.
journey over the past 10 or 15 years to get to this point, but it hasn't been quick. It's been a long time in the making.
But I can hear that you've had not only lived experience
Mm.
as a pharmacist and working in some really difficult situations, and it sounds like I love when people see gaps in services or gaps in needs and then pull brains together to create some form of tool. It's really good to hear.
Yeah, no, it's been wonderful to be able to do, particularly this project and the co-design, and working so closely with both consumers and healthcare providers to come up with a resource
Yeah.
that people have found really valuable, has been great. And we know for the toolkit already, we've had I think around 48,000 people have accessed the toolkit online.
Oh,
So we are starting to really get the word out there, and we hope the more people that sort of are able to access those resources, the more we'll be able to address the kind of stigma that there is around opioids and the knowledge around opioid safety.
well, thank you so much for joining with us. It's such an important conversation. Like I said to you, I was around when the opioid reform hit in 2020, which is such a difficult time. So to have resources and tools come out to support people as they're having conversations and just acknowledging the fact that these conversations are happening and we need support and services for people to do that. It's really wonderful. Thank you again so much for joining us, and we will link all of those links below this video here, not only online but also through Manage Endo. And thank you again, and we hope you have a wonderful evening.
Thanks so much for having me.